Hi everyone, my name is Morgan and I'm an FNP student at Brand New. And today we're going to be discussing appendicitis. Well, what is appendicitis? Appendicitis is a condition where the appendix becomes inflamed, swollen, or filled with pus. Well, one might say, well, Morgan, what exactly is the appendix and where is it in my body? So to help us figure it out together, I have printed out a diagram to show you. Okay, so this highlighted portion right here is your appendix. And your appendix is a small tube of tissue that projects from your colon to the lower right side of the abdomen. So here, as you can see, we have our colon, which is also known as our large intestine, and our small intestine right here. And our appendix is where our small intestine meets our large intestine. And that portion of the large intestine is called the cecum. So it's a little portion off of our cecum, okay? So some might say, well, what is the role of the appendix? Unfortunately, the role of the appendix in the body is not quite clear. However, studies do suggest its relation to abdominal immunity and fighting infections is the role it has in our bodies. And who can get appendicitis? Well, unfortunately, anyone can. It's more prevalent in people between the ages of 10 and 30. The incidence rate of appendicitis occurs about 7% in the U.S. population, with an incidence of 1.1 cases per 1,000 people per year. Unfortunately, if appendicitis is left untreated, it can burst or leak, spilling infectious substance into the abdomen. This can lead to severe inflammation of the abdominal cavity, which can have negative outcomes unless treated. So let's jump right into it. What are some of the causes of appendicitis, since anyone can get appendicitis? Well, appendicitis is caused by blockage of the appendix. The blockage may be a result of thick mucus that builds up within the appendix, or it may be due to stool that becomes lodged into the appendix from the cecum, which we learned that the cecum is that beginning portion of our large intestine, and it's where our large intestine meets our small intestine, okay? So unfortunately, that stool or mucus hardens and blocks the appendix. The blockage causes the appendix to swell, and after the appendix is blocked, bacteria found in the appendix begins to double and invade the walls of the appendix. The body then responds to bacterial invasion, causing the appendix to become inflamed or swollen. So that's how we get that swelling and inflammation in the appendix. So what are some of the signs and symptoms of appendicitis? Well, some of the major signs and symptoms include loss of appetite, abdominal swelling, constipation or diarrhea, fever, which is something we see with inflammation and infection. So fever that's going to worsen as the illness progresses, nausea and vomiting at the onset of abdominal pain, and really that telltale sign of appendicitis is going to be that dull pain anywhere in the upper abdomen that moves to the lower right abdomen and becomes more sharp as it moves to that lower right portion. And some people may have painful urination or difficulty urinating. However, approximately 40% of people do not have these typical symptoms, so it may be difficult to diagnose at time. Speaking of diagnosis, the diagnosis is largely based on a person's signs and symptoms. In cases where diagnosis is unclear, close observation, medical imaging, and laboratory tests can be helpful. So, what are some tests and procedures that are used to diagnose appendicitis? Well, first and foremost, upon physical examination, when we apply gentle pressure to the painful area, as soon as we release the pressure, you're going to have some pain, and the pain's going to worsen, okay? That indicates an inflammation and infection of the abdomen. So another test that we can do is a blood test. Well, what do we see in this blood test? You're going to see an elevation of white blood cells. And what does that indicate to us? Well, that usually indicates an infection somewhere in the body. Another test that we can do is a urine test, also known as a urinalysis. It's a microscopic test of the urine that detects white blood cells and bacteria in the urine. This test would be in abnormal range when there is inflammation or stones in the kidney. Usually we do, you might say, well, Morgan, why are we doing this if I'm having inflammation of the appendix and it has nothing to do with my kidneys? Well, your kidneys are you have one kidney in that same area as the appendix. So we want to be sure that appendicitis is the correct diagnosis. So a urinalysis is done to rule out the possibility of a urinary tract infection or kidney stone to ensure that that's not what's causing the pain here. Another procedure that we can do to diagnose appendicitis is imaging. Well, imaging such as X-ray, ultrasound, and CT scan are used to provide visualization of the abdomen, which can be used to check for inflammation and rule out other possible diagnoses such as ovarian cyst in women or obstruction in the intestine from stool. Although CT scans have been shown to be more accurate than an ultrasound in detecting appendicitis, ultrasound may be preferred as the first imaging test in children and pregnant women because of the risk associated with radiation exposure from CT scans. So what do we do with this diagnosis once we have it? What does the treatment include? Well, the standard treatment for appendicitis is unfortunately surgery to remove the inflamed appendix. A dose of antibiotics is usually administered before surgery to prevent infection. The surgical procedure to remove the appendix is called an appendectomy. During this procedure, a small video camera and a special surgical tool are both inserted into your abdomen through very small incisions to remove the appendix. The benefit of this surgery is that it allows for a fast recovery, less pain, and less scarring. Unfortunately, if the appendix has burst and formed an abscess, the pus or fluid formed by the abscess needs to be drained. This can be done by placing a tube through your skin into the abscess, which allows the abscess to drain, after which an appendectomy is performed to remove the appendix. Thank you so much for watching today, and I hope this has clarified appendicitis for you.